Thanks for staying with us. It's still our Healthy Tuesday, so we're discussing health. So the president of the Guild of Medical Directors, Dr. Raymond Kuti, has said that 50% of private hospitals have shut down due to hardship, with those remaining barely staying afloat. According to him, he said averagely 3 out of 6 private universities, private hospitals actually, are shutting down every month in Nigeria, primarily due to the challenging economic environment, and they are calling for government's intervention. He has said that also, particularly, that the Band A facilities has caused quite a hike in the electricity bills, and also some of the tools and equipment that is used in the hospitals are imported, and obviously the dollar rate and the forex rate has caused it to be so expensive to import some of these equipment into the country. So in his report, he says 50% are already shut down and more are shutting down. What are your thoughts on this? This is quite disturbing. What do you think we can do, and how do you think we can improvise? You can call us on 081-0764-1679, 090-241-63440. You can also send us your thoughts on YouTube and on X. Okay.
So yeah, I'm really, it's a very disturbing data, but it is not a shocking data. It's disturbing, but it's not shocking because Manufacturers Association of Nigeria has been shouting that businesses are shutting down at a higher rate than even 50%. So obviously, it would affect the hospitals as well. We just did not think of it, and we're not conscious of it. And we do not have enough general hospitals to meet the needs of the medical needs of Nigerians. So this is a crisis. We cannot afford to joke with our ministers for health, states and substantive, commissioner for health across every state. There should be weekly meetings to discuss and monitor progress reports on what we are doing to address the crisis in our health sector. There is a crisis, like state of emergency level of crisis. If 50% of private hospitals are shutting down because of economic hardship, then it means, and the same thing, papers today were carrying the thousands of doctors that are leaving because of the fact that they are not being well paid from NMA. So who is going to take care of the Nigerians that are in Nigeria if we do not declare a state of emergency to ensure we are solving the critical problem of you need to be alive to be able to pay taxes, and our government is depending on tax to generate revenue. You need to be alive to be able to earn money to sustain the economy. So I feel that there should be a state of emergency declared on our health sector. There should be concerted efforts between all our commissioners working together to address to identify what the problems are. Thank God our last guest was talking about research, because if you don't know what the problem might be different. The issue causing shutdown in Lagos might be different from the issue causing shutdown in Kano. Kano might be that we don't even have any doctor or nurses. All of them have left. They've gone to Lagos. So that's why we have to shut down. While in Lagos, the issue might be that we cannot sustain what power is. I went to watch a movie, Morayo, and the cinema lobby was hot. They didn't switch on the AC in the cinema lobby because of Band A. And I was like, oh, why are we sweating here? They say, we cannot run the AC in the cinema lobby. We only run ACs in the where you are actually watching the movie. That's the only place they run it, because they had to find what are the ways we can reduce the cost we spend on power. So yes, power is a major crisis right now. Businesses are struggling. And
but you can't improvise health.
You cannot afford to. It's life and death.
Yes.
If you make any mistake.
Yes. So I know for certain that in Nigeria, the government, we do not prioritize healthcare. I just feel that because there's a norm that our leaders, that when they're sick or something is happening with them or their families, everybody runs abroad.
They carry their bag.
Because they can afford the healthcare system abroad. You're going abroad and then you don't want to solve the problems here. So with the citizens that are paying the taxes that can enable you afford to go abroad to get the good healthcare, we're crazy. So we need to do a lot. It's not just about having the private hospitals are now here to help subsidize or the public hospitals, right, to make it better and stuff. Yet we're not giving them the adequate support that they need. We want state-of-art equipment. This equipment must come from abroad. When they say they're removing VAT and all those things, they should start from the healthcare, so that this people can bring in those equipments that they need to do research, that they need to take care of us, that they need to do heart, brain, all those transplants and surgeries, right? They need that one. Then secondly, when they have those things, the doctors, is it ghosts that will come and work there? They're human beings. They're not paying the doctors well.
They've jackpot
because they've jackpot to better. Who doesn't want better?
Are we addressing the jackpot also?
Yes, both.
I think that's even the first thing to address.
Really?
If there is any... Yes,
No.
because the first thing is what is making them leave. It's conditions of living. Yes. Let us be very honest. There are a lot of times that we have callous leaders, and that's just the truth. Because, like you rightly said, they can take their bag and the next headache, the paracetamol has to be from the UK. I mean, the paracetamol has to be from India. And those people who cannot afford it here are left to just, waste away. Because yesterday, when I saw this news, as late as it was, I had to do some research, and I noticed that in August 14, 2024, this year, FG unveils plan to bring back 12,400 jackpot doctors. Unveils plan. Has that plan been implemented? And this was in August. Now, I think around, this one is October 20, 2022. Brain drain. Nigeria needs 363,000 doctors, but has only 24,000. 2022. Now, there was another one that says, this one is March 11, 2024. Brain drain. Nigeria now left with 55,000 doctors and 16,000 emigrants. In fact, we are always counting. When is it time that we are going to really nip it in the bud and do the work? Because these doctors, Madam was just talking about even trust. That's where the people who are not qualified erupted from, because the ones who we trust, who have gone through school to do the job, have left. Now, those ones have seen a vacuum that, okay, even if you're a traditionalist, they'll come, they'll sit down, they'll say, yeah, they're doing consultation. Go and look at TikTok, how a lot of traditional doctors have flooded TikTok, and they're doing consultations right there on social media apps. So it brings us back to the fact that we are still putting square pegs in round hole. And until we get that, maybe we'll keep rigmaroling, because this news...
your square peg and round hole.
They've been jackpying since, I think in Jonathan's era, the figure was very reduced. My people will say, Atibi, Shanoki, so it's from the minutest thing. Now, it began to skyrocket. When Buhari came in, we saw the increase in number, which was way, way more than Jonathan's period. Now we know what it is. So we follow through that progression. Don't worry, 200 have gone. We still have 1 million. Don't worry, 500 have gone. And that's what we have now.
Okay, so again, I like to always see things from different perspectives, because I agree with the president saying that, the president of the Guild of the Medical Doctors, saying that 50% of our private hospitals are shutting down. And there are various factors. Now, the factor he has obviously highlighted are the fact that obviously many of them cannot pay the electricity bills, and they're importing some of the goods. But there's other factors that if we look at other countries where they have private hospitals, this sector is highly regulated. In Nigeria, anybody can wake up tomorrow and say, I'm a doctor, and start a hospital. Quack hospitals are there, millions of them are there across the country. Some of these guys, when you have this stringent, when we start having stringent policies, some of them are forced to shut down. So are there other factors that are causing the shutdown? Or how do we conclude that it's only because of the Band A issue, or because of the floating of the Naira? Because sometimes when in a country where there's lawlessness, everybody can wake up tomorrow and say, I have a hospital, I have a private school, I have this school. But as the government is gradually putting policies in place to close certain gaps, we will see quite a bit of shutdown. We start shutting down of manufacturing, because some countries, some companies, not that because they couldn't afford it, but because they realized that the waivers they were getting easily, they can't get anymore. The ease they had with the corruption, it wasn't blocked. So some of them had to leave because they couldn't continue as business as usual. So is it possible that some of this shutdown is not necessarily because of I'm not saying that's a factor. I'm just saying, should we consider the fact that some of these hospitals might actually not have been certified to run practices, and that's why they had to shut down? So,
you've made us to see the advantage of the educational sector, and how those, there's a word you use to describe the smaller...
Wait, come to me.
Yeah, so these are schools that are like, they are like schools. Private schools, but they are for the poorest of the poor. Private schools, just so that people will feel like they are going to a private school. So they exist there. And in first reaction is to feel like, let's shut down all these mushroom private primary schools, because they are churning out half-baked people. But what we got later was that they are actually meeting a need, because there was a gap they were meeting. So sometimes it's important you might have to manage something that you feel is not good enough, because if you take it out, the cost of it is, that thing you are complaining about is still saving 1,000 lives. But when you close that thing, you are losing 2,000 lives.
That's what happened with subsidy.
Yeah, so that was what subsidy was doing for us.
That's what happened with subsidy.
But as we are right now, hospitals, those hospitals that we feel might not be up to standard, they are shutting down. You remember the hospital that saved your son few years ago, and you went back there, and the doctor has closed because he could not afford to maintain the facility, and he shut it down. I had a very good dentist. I went for my first checkup, second checkup. By the time I was going for the third one, alas, I got there. Oga owns the facility. He has jackpot and left people there. When they did my tooth filling, it did not reach 1 month. The filling went out. I went back there again. The filling went out. So obviously, the guy that was good, he has gone. The ones left were managing. As of this year, that facility has shut down because he was trying to manage it from the abroad. He cannot manage it again. Business must close down. So we have a problem. We might question the data of 50% or if it is based on power. But the truth is hospitals are shutting down and it is a reality that is affecting Nigerians and increasing the death rate that we are having.
Let me take this call.
Someone sent me a message. The lady said that she's having headache, she's having back pain, having this one. And when they told her to go to a hospital to do check, because of the fear, she was considering that she saw somewhere on Instagram that she should pay 10,000 naira. They will give her some herbs that will help to purge the issue. And I saw the message and I was wondering, did you go to school? But I guess
she's considering the option. Let me take this call. Elder Henry and Akamsamaka. Good morning, Elder. You're live.
Good morning.
Morning, sir.
Good morning.
I totally disagree with Morayo on your view because even though you saw the quack hospital, they are missing some needs. People within them, we are receiving medical services to their head. Our president has just returned from abroad recently. I hear say my treatment you go for abroad. You can see that he's very fresh and renewed and agile. When he was going away, he was tattered. If all what is spent in abroad is better in the health sector in Nigeria, it will be better for all of us. Have a good day.
Thank you very much, Henry. Yes, Amaka.
Yes, so we need to understand that we live in a different times now in terms of our lifestyle, right? So I think like when we didn't need the hospitals, we had the hospitals. In our parents' time, now that we need the hospitals, we don't have them anymore. Because now you see that the high rates of autoimmune diseases, cancer, rates of a lot of things. Younger people having heart diseases, slumping dead, lots of guys having prostate issues. So the lifestyle, what we eat. So now we need more medical attention. I don't know what's in the air, pollution, So the government needs to prioritize this. No matter what you want to say. It's not about policies. Healthcare is healthcare. We have policies in education, in healthcare, in every sector. That before you start something, we have the tax officials and people that will come and disturb you that you do not do that. We know that. So with that, you're saying they are not meeting to certain standards, but they have the license and the whatever certification to open in the first place. Power goes a long way to them running or powering those heavy-duty equipments that we need. That's the reality. And for example, just imagine putting hospitals in band A. How are they coping? Because hospital, for you to have IC, all those things, you have to, that's what I'm saying now. You have to, that's what I'm saying, you have to run, so it has to be subsidized for hospitals. Healthcare has to be subsidized.
I think a lot of things can be subsidized. Let me give another angle to what I'm saying. Let me take this call, Mr. Abdusalam from Niger State. Thanks for calling, or Mrs. Abdusalam. You're live, madam.
Hello.
Yes, ma'am.
Hello, good morning.
Good morning.
Yeah, this is Abdusalam from Niger State.
Go ahead.
It's not Mrs. Abdusalam from Niger State. Sorry, you guys are doing well. I want to give kudos to those over there because I've been watching the program over every day. Thanks for those views and suggestions and observations.
Thank you, madam.
But in the health sector, there's a big problem that people are facing in Nigeria. You see, these are 50% of the government services that you need to shut down. It's due to the harsh drainage because even the government of people cannot even afford it.
It's really difficult to hear you because of the echo behind is hard because you're listening to the TV, so it's difficult for us to hear you properly. Okay, so I totally agree. I am not against what the president is saying, and I totally agree. I'm just saying that we should also see things from other perspective. So, for example, you see hotels everywhere. Everybody wake up tomorrow and start a hotel. Down the street, there's a hotel, everybody has a guest house. And because, hey, nobody's really clamping down on these things. Tomorrow, something happens where they're realizing that they can't afford their Mbande. Before, it was easy for you to just start a get a hotel. Yeah. Before, it was easy to just start a club because, hey, the electricity is cheap. Everything, we just do things anyhow. Suddenly, we now have restrictions where it's expensive to have electricity. Now, you now know the kind of business you go to. If somebody tells you to start a hotel, you think twice because you remember all the costs of the electricity that you're going to incur. Wow. Same thing, you want to start a club. So that's the point I'm trying to make is that there's some people that have some quacks out there. There's some people out there who just start these things without thinking on the right, following the right policies. Maybe some of these are shut down. Now, I don't expect the guild to have those people within their own network, certainly. So the data he's likely to be using is data from a reputable organization as theirs to know 50% of them are actually shutting down. So that is a given. I'm just trying to make us understand that the reality of our times is that more companies will shut down for different reasons.
Absolutely.
Hotels, clubs, businesses that have not
factories.
been, that many of them will shut down for various factors aside from the Band-Aid factor. That was the point I was trying to make.
You remember when Dunlop left Nigeria, Michelin? Why did they leave? They left because there was no power supply. Now that we have power supply, some people cannot cope because it's coming at more, it's coming at a very expensive rate. So
others will come.
Let's put it on a variance because a lot of people who are leaving, even I think there was this syringe company, one of these drug manufacturing companies too that left. Based on the fact that, okay, Naira is afloat, conditions of living, this and that, they are living. They even still have the power. I'm now thinking, if we rewind back, are we still going to be able to woo the type of Michelin to come back to Nigeria because there's electricity supply? Now it's coming as more expensive. So sometimes we need to put on a scale. Why have people left in the past? Why are they living now? Yes, definitely. In another 10 years, people might still leave if we are still on this kind of train because we have been pushing it from like 10, 15 years ago when I learned that some of these companies had left initially. So if we do not continue, if we do not start it now, I remember that I saw one of the Oni of Ife's video. We have a call?
Yes, I do.
Okay.
Let me take this call from Yakub. He's been holding for a while. Good morning, Yakub. You're live.
Yeah, good morning.
Good morning.
I don't know if the line is clear anymore. Can you hear me?
Yes, we can.
Yeah, thank you very much. For me, I totally agree with all of your points. Majorly, the power is one of it that making people shutting down. You know why? Why? Because, before now, I've never had power holding company telling us that there is a band A, band B, band C, even to F or G at KCD. Now, what is the power that we are generating this contract today? Even the power that we are generating, the distribution company cannot be able to hold it enough. So even give it to customers. And then you're not telling us that we are in band A. Do you know, even we had complained yesterday during the Mr. Yori's program this morning. Do you know this guy, Morayo? I will continue saying this every time I have opportunity saying it. I bought my meter by myself. You see, it's annoying. And when you guys came, you told me that the meter is outdated. Meanwhile, the meter is still working, but you say it's outdated. And then you restrict the meter. Okay, give me another one. You ask me to go and buy another one by myself again. And then you're not giving me a estimated bill of 20-something thousand. Meanwhile, I'm managing to do 6,000, 7,000 before. So, what I'm saying in essence is this. Morayo, if the Nigerian government was to accept people, they should mandate this power holding company for giving individual meters. They should not be able to give them up estimated bill. This is hospital. That they say, if they are be able to control their life, they will not be able to shut down. What is the meaning of band A? It is a type of the street of where. What is band A mean? That can work every time.
Thank you very much. Let me go back to what Maka was saying earlier about subsidizing, because there are some organizations or some services that should be subsidized. And I totally agree with you. At what point do we expect the president to come forward in this matter? Because the educational sector cried out that they are getting 300 million naira bill from Band-Aid, from electricity, from the distributions, right? Then healthcare is shouting out. The schools, which are important for the organization, is also shouting out. So we're asking the government, some of these key and critical sectors, can they subsidize power to them? And I think there was a time that the government was trying to see what can be done to subsidize some of these things, because we can't expect children going to school or universities in darkness just because they have bills to pay. That's unheard of.
Shut down because
so some of these schools are shut down too. So we have hospitals, we have basic education to having these issues in primary schools. So at what point do you expect the government or the president to come to intervene and ensure that these hospitals, even though they are private, should be giving some kind of subsidy?
I think there was a news like that about 2 weeks ago, 2 to 3 weeks ago, that the president had said they should subsidize certain tax for certain sectors.
For a long time, we have been living above our means. We have been living the life of we have been jayoriwa, we have been chopping the life
of our head.
So, and it is coming to bear on us now. Education isn't cheap anywhere in the world, aside from Nigeria. It is relatively cheap. Neither is healthcare. It's ridiculous how expensive healthcare is in other parts of the world. And so, thinking that we can, thank God we have watched plenty Hollywood movies, so we know that it is not cheap to run healthcare in the UK. It's not cheap to run healthcare in the US. And people are also scamming the system. That's why there's insurance. So the point is, like the lady said, our former guest said, the doctor said that it's hydra-headed. There are many issues we need to deal with. We need to pick the one. Okay, if we say that power is a major issue, I would say power is a major issue, but the truth is, you cannot. Our country cannot continue to live on subsidy. Subsidize this or subsidize this or subsidize this. We need to increase our capacity to handle the responsibilities of being adults. This is adulting. That's the Nigerian government before used to be like a child that they were giving us food from petrol. Crude oil was feeding us. Now crude oil cannot feed us. Our mouth has become so. Our stomach is now big. We have outgrown breast milk. We need to become adults, and adults will face reality and responsibility of adulting, which would require us to think creatively to solve this problem. Our insurance, HMO, there was a scam regarding the insurance, health insurance policy system they were going to do a few years back, and we never really got it right. It was supposed to be a big move from the federal government to ensure that every Nigerian has health insurance, so we can go to the hospital and access care. The hospital can get the money needed out without having to be subsidized. So insurance is what might be the best solution to support us on the journey. Because with insurance, we can pay our doctors well without subsidizing from government to support the doctors. With insurance, they will get drugs. If we begin to look at it holistically, we'll be able to find the real ways to provide healthcare for Nigerians. But these statistics right now requires urgent attention.
CMO, I do not agree with you in the sense that, you know, when you pay your tax to a country, the country is supposed to take care of you and subsidize certain things. Look at the UAE. Look at Switzerland. There are so many other countries that I'm coming. There are so many other countries that if you have natural resources, we have more than enough to take care of the citizens of this country. We need to deal with corruption. We need to deal with a whole lot of issues that, if we deal with those issues and we are honest about it, a lot of things can be taken care of in our country. Do you know the amount of natural resources we have that you're trying to say that Nigeria should kill themselves or whatever? No. Let's not do that. Nigerians are suffering.
Yes.
The economy is bad.
I agree.
The government needs to cut down a whole lot of waste and excesses. And then with corruption, we have natural resources that can take care, even if the only thing they do for the Nigerians, the government says, for the next 10 years, we want to focus on only 2 things. Power and our health care. Let us be alive.
Well,
then let us have and then if they can just focus on pick 2 things and say for the next 10 years,
I agree too.
This is the only thing we want to give the citizens. It will work.
I agree in that terms, because a lot of times I say it like, let a new government not come with 7-point agenda, 10-point agenda. Pick 2, pick 3, that is cocoa, and face it and do it in your 4 years. That 4 years now will speak about your scorecard, and people can say, oh, if you have successfully done 3. We've been on this power issue since forever. And now it's better. But like we say, we keep talking the talk and doing less of the work. And like what Amaka said, if we are being honest with each other, in other countries, businesses are folding up. Okay, look at it. In Nigeria, I have not heard that churches are closing down. Maybe they should take the lights from church and give hospital.
Is God not a God of...
And now open the roof of the church.
We paid for this in our church.
I love
this.
Look, maybe we should start having churches run hospitals and schools. Maybe that way we would have a more better system of education. Because if the churches are able to sustain their parishes, it means that they can sustain hospitals and they can sustain schools. We've seen what Covenant University has been able to do.
Yes.
When they list universities in Nigeria right now,
800.
you don't even globally, it will still be.
Somebody told me, Morayo, that I have been hiring schools. I've been hiring students in schools.
I knew it was that school.
That's the only one I can boast of. They produce quality Covenant University will give it to them.
So if they can do it, maybe we'll now have every other university, every other religious organization to set up schools and let Nigeria, because since one thing we get right is religion. Maybe the religion can help us get other areas right.
Let me tell you why I like the way this conversation is going.
Catholic schools.
Even your own church that would be donating visit school bag.
Yes.
For thousands of people. Like these churches have been having administrative experience over decades. If it's to feed 1 million, they know how to do it. If it's to provide service to certain people, they know how to do it. So maybe we should start subletting our hospitals and our schools.
But I need to address what Amaka said. Many Nigerians will come and say Nigeria has money. The truth is, Nigeria looks like we have money.
We are poor.
You see, may God give Nigeria the kind of money that Nigerians think that the government has. That's it. We are a government that the government is living off the future, we say. Like they are we are borrowing money to live and maintain a lifestyle. So Nigeria is still looking like it's big. And we're still not cutting corners. So I agree there is corruption that needs to be dealt with. So Nigeria has a problem of corruption. Nigeria has a problem of mismanagement of the funds available, but we don't have the funds.
Can I hear Amaka and say that you look more expensive than your bank account?
I don't know. But you don't know what is in my bank account.
I don't know what's in my bank account.
So you can't say that.
It's our culture in Nigeria.
I'm even living below and looking below my bank account, baby girl.
No, so the reason I want to yab is that I'm not yabbing you directly. What I'm saying, many of us, all of us,
honestly,
Morayo,
I look more expensive than my bank account.
So you think I'll have money? People come to me because they've told us that you have to dress the way you want to get packaging. That's Nigeria for you. But we package, we ain't got nothing.
But I don't think it started with us. It started with the fact that I know that when you want to go to a company and you want to bid for a certain amount of contract,
they will tell you.
They will look at you they will ask somebody to accompany you to your car. Yes, and they will look at you like, is this our money this one wants to use?
So that is the Nigerian factor that we've ingrained in our system.
We get entrenched in all of this. How can't we just step out?
We have to wrap up, unfortunately. We have to, because I really like where the conversation was going. All of us, I always say, when you point at government,
it's coming back to you.
All of us were like that.
You're going to one gala event, you're spending 1 million.
Let's go on a short break, because today is Healthy Tuesday, and we still have one more doctor to talk about. But in a nutshell, wrap it up for us.
We need the government to declare state of emergency of our health sector and let us know what they are doing so that we will be able to trust them on that journey and have renewed hope.
And Damilola has suggested that maybe we should sublet some of these sectors to our churches because they're quite organized, and I think it's a good idea. Let us consider it. Give Daystar some, give Covenant some, give our RCCG.
So if you're not a strong church, don't come up.
RCCG feeds millions in December. Our convention that we have, millions.
And there's no stampede.
No stampede.
There's no food
organized.
It's organized. We are feeding, they are killing cows, they are cooking rice. Yeah. December is coming now, we'll do it. August, we did it. Let's go on a short break. When we come back, we take our doctor. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.